Amanda is a licensed clinical therapist and owner of a group private practice specializing in the treatment of eating disorders, avoidant restrictive food intake disorder, metaphobia, pseudodysphagia, and phagophobia. Amanda has experience as a clinical medical social worker, and she used to work with us here at Stanford, which is how we are aware of her. She was one of our wonderful head and neck social workers previously. She completed a master's of social work at San Jose State with a mental health concentration and a graduate level eating disorder certification through Lewis and Clark University. So it's a pleasure having you back with us today.
Thank you. All right. So I wanted to start off. Heather did a great job kind of painting a vignette that's very similar to some of the things that I'm highlighting here. But I wanted to start off with this slide because I feel like any of the patients that show up for treatment that are struggling with dysphagia, there's just so many different elements of their lives that are being affected by the dysphagia, including mood, increased feelings of guilt and shame around dysphagia, which is fascinating. But studies show that that's one of the things that really kind of comes up. Social life is affected, also family dynamics, all these different aspects are affected. And so I consider these different aspects to be kind of the backdrop to where we're kind of starting from with treatment. I also feel like it's important to consider co-occurring mental health disorders. So we know that depression and anxiety tend to be higher for people with, tend to be higher for people with dysphagia. Also can cause dysphagia to be higher. Yes, yeah. Both those two. And then we also see higher rates of panic disorder, OCD, PTSD, social phobia. So there's a lot of different kind of co-occurring mental health disorders that can layer upon one another. And so when I have a client come in, I think kind of taking a look at all of these different components are really, really critical, because where we kind of start with treatment is going to be dependent on a lot of these different elements. And my presentation is going to talk about a lot of the different considerations that I think are really important when someone is coming into treatment when considering the whole person. I have neurodivergence with the little star. I don't have a ton of research on this, but anecdotally, I have seen a lot of neurodivergence come up with clients that I find struggling with swallow. And I find I have a slide on sensory sensitivity and the importance of kind of taking into account sensory sensitivity in treatment. And so I included this on this slide, even though I don't necessarily have the data, just because I do think it's an important thing to consider while talking about treatment, and an important thing to discuss. So one of the treatment options for people struggling with dysphagia due to psychological overlay is cognitive behavioral therapy. As the title suggests, it is a very cognitive approach. It's definitely focused on the brain, and so I find that cognitive behavioral therapy can work best in combination with a lot of different other modalities. And everything that I'm talking about today, I'm going to be talking about kind of individualized treatment, because I don't think that it's a one size fits all treatment. I think that every patient that comes in, you do have to kind of take into consideration all of their individual needs, and those needs definitely dictate the modality that you use. But basically, in cognitive behavioral therapy, you're identifying some of the different thought distortions. And with phobias and things like that, there's some thought distortions around swallowing, and that have really kind of blossomed and become unrealistic and just not accurate. And so challenging some of those negative thoughts and replacing them with thoughts that are more accurate. and adopting new behaviors is one of the strategies that is helpful. That being said, that's all real cognitive, and most people need more than just kind of talking through things to really be able to see some change around their swallowing. So I also included some information about mindfulness techniques as well. In my resource segment, there's also a ton of different mindfulness techniques as well. Two that I really want to kind of focus on are, I find breathing techniques to be helpful, and progressive muscle relaxation, because there is kind of the mind-body connection, especially with swallowing. Progressive muscle relaxation, we know that muscles in the throat, it's important to have relaxation. And when people have a little bit more control over being able to relax their body, it makes a world of difference psychologically in their ability to swallow and to stay comfortable in swallowing. Breathing exercises, I feel like are a go-to for a lot of clinicians. My one caveat is I feel like they can be kind of polarizing. So many people find them very soothing and calming. However, people that are struggling with swallowing are, if they are asked to then, kind of mess with their breathing, it can ultimately become very dysregulating. And so it may not be the first exercise that I work with someone on, because it can, for some people, it can actually be very kind of stress inducing. It may be something that we work our way up to. And then exposures. So basically, creating safety is incredibly important when there is a psychological overlay to dysphagia. And so in creating an exposure food hierarchy, or it doesn't even have to be food, it could be liquids, it could be scenarios. If someone is very scared of swallowing food while standing, or swallowing food not having both feet on the ground, or whatever the scenario is, creating a hierarchy from lowest fear to highest fear is helpful. And you're starting at the lowest fear item. And the reason is because each of those steps up the ladder is creating more confidence for the client. And that confidence is what is going to help them to tackle the bigger fear items and really make some progress. And my belief is that doing exposure therapy really needs to happen in the context of safety. And that's one of the reasons why I'm going to be talking about sensory sensitivity and things like that, because I think those things are so important. If someone is not feeling safe, doing exposure therapy is terrifying. So, and I like this slide because it kind of shows the loop that people can get stuck in when they are having a negative experience with food, or in our case, a negative experience with swallow. But when someone is continuing to keep themselves kind of in the same loop and beginning, and we see this with OCD as well, they may begin making choices that keep them safe and doing things that they think are limiting foods more so, and things like that. And so they keep trying to make themselves safe, and their brain then begins to believe that that's happening, that it makes the fear valid. And so really kind of one of the ways to get someone off of the loop is to challenge the fear, is really kind of where the exposure therapy comes in. Three key treatment considerations that I really like to consider for fear of swallowing. One of the biggest ones is trauma, and this was discussed earlier. So radiation treatment, surgery, feeding tubes, we've talked about these things. They by themselves it may not be traumatic. It very much kind of depends on each individual person's experience. For some people, it may very well be an incredibly traumatic experience. Other people may not have a traumatic experience. And then you could have a lot of layers of different things happen. So someone could have had as a child a traumatic vomiting experience that already kind of predisposes them to have some fear around food. And then on top of it, there is medical trauma that's layered on top of that. And so really kind of understanding those different layers of the story, I think is critical in treatment. Sensory sensitivity, if you have someone who is a super taster, their experience of food is pretty wildly different. And so when you're doing food exposure, it's important to be aware of that, because as they are experiencing food, they're experiencing it in a different way than someone who's not a super taster would be experiencing it. And I'll dive into that a little bit deeper as well. But also loss of interest, I think, is an important thing to explore. There are some people who have always had a low appetite and low interest in food. There are some people that it is new with dysphagia that there's that loss of interest. And so kind of knowing what their journey is around food is helpful in kind of help supporting them either in learning a new relationship with food or getting them back to on a path of joy and experiencing fun with being able to eat and swallow. Trauma, having a full understanding of the trauma is helpful, and there's various ways that trauma can be processed. And so, yeah, there's either talk therapy, EMDR can be very helpful as well if there's re-experiencing trauma that's occurring with PTSD that's maybe associated with a choking or medical event. And so there's some different ways to kind of process trauma, but being aware of the trauma at least is very important. Sensory sensitivity, this is one of my favorite areas. So I put hyper and hypo because people can kind of, people that are sensory sensitive, and this is not just people that are on the spectrum or people that are neurodivergent. Everyone can have different areas where they're kind of particularly sensory sensitive, and they can either be hyper or hyposensitive. They can, and it doesn't have to necessarily be, or it's almost never kind of across the board. So usually people may be hyposensitive in one area, hypersensitive in another area, and so it's important to kind of have an understanding of patients' preferences, because in treatment, those preferences can make a really big difference. An example that I have a young man who has an auditory hypersensitivity. I meet with him virtually on Zoom. He can tell if my neighbor has her sound machine on and is so distracted by this that he has a really hard time functioning in our sessions. And that is how like sensitive he is to noise. And so I didn't know that for a few sessions. And so that was something that we had to kind of figure out, but really key and incredibly distracting to him, any noise. On the other side of that, there are also people who I will work with, and we will play music while we're doing food exposure, because music's really calming and soothing for them. And so as we take a look at all kind of 7 senses, there are kind of different extremes for things that can either be helpful or really not helpful. Doing food exposures while sitting against a wall can be really soothing for someone who has a tactile sensitivity. Someone else can find that incredibly dysregulating and can almost feel trapped by that same experience. And so keeping these senses in mind and almost doing like a sensory assessment can be helpful if you have time. Lack of interest is the last thing that I wanted to speak on. And usually what I do on this is just really like anything to increase joy with food and eating, whether it's kind of in environmental joy, play, incorporating fun and games with the swallowing and eating, which I know sounds ridiculous, but it is what I do. And switching up temperatures, textures, colors, presentation, just any kind of creative things to really kind of liven things up when a lot of times our patients' experiences around these things have become very bleak. Any ways to really kind of lower pressure and reduce shame, I think is incredibly helpful. And that is it.